everyone, this is Andrea Schindel again, and I'm a licensed professional counselor, and I specialize in working with trauma. And I love working with families who have adopted or have done foster care or who have dealt with a lot of grief and loss. So tonight I'm going to talk a little bit about how to know if the therapist that you're seeing is competent in working with trauma. One of the main red flags is walking into the office and feeling like you are having to educate the therapist on what they should do. So oftentimes my clients will walk in feeling very discouraged. Sometimes I'm the fifth or sixth therapist that they've seen, and they often feel like nothing will help them. And that could not be farther from the truth. You can heal from trauma, and so can your children. Oftentimes, therapists in staffings will label a client as resistant, and that is a huge red flag because we have the responsibility as professionals in being able to advocate for our client and recognize when things are beyond our ability as a therapist, but not blaming the client. Second red flag, feeling like you're being interrogated. A therapist should never be in the position of investigating. So asking too many detailed questions, 20 questions is one of the most recognized, hated ways of a therapist approaching a client who has been traumatized. The details are never as important. The content is not important. What's important is the client's experience. And so if a client is dealing with trauma, they often can't give you details. And trying to get details as a therapist is irrelevant. So that's another red flag. The third red flag, especially for foster and adoptive parents, is feeling blamed for your child's behavior. If you feel blamed for your child's behavior, that's a huge red flag for adoptive parents. What we want to do is understand the child's behavior. And as a parent, often we go on burnout. Caregiver burnout is a thing. And as a therapist, if we sense that a caregiver is on burnout, we don't blame them for the child's behavior. That's ridiculous. So we have what's called a parallel process in therapy. If the parent is presenting as though they're blaming their child for the behavior, then the natural thing for a therapist to do is often blame the parent for the child's behavior. There's a parallel there. That is a complete miss, and it's a red flag that a therapist is not equipped to deal with trauma. What we do is meet the parent where they're at, and if they're burned out, we offer them hot tea and some comfort. Taking a burnt out caregiver and blaming them for the child's behavior is never going to work. No different than bringing a client who has been traumatized into a therapy room and blaming them for all of the inexplicable things that they're feeling and dealing with every day. So we have to do the parallel process the same way that we would with our clients with a caregiver. So that's another red flag. If you feel blamed, get out. That therapist does not know what they're doing. So I hope this has been helpful for you. I know it's kind of a short video, but it's a really important part of deciding whether a therapist can really help your family or not. And I am going to go more in depth in another video on how to tell if the therapist that you're working with is actually making progress with your child. Because oftentimes children and caregivers are separated in therapy, and that's not always helpful. Thanks. And I'm going to go out with my family tonight. So that's why our video is kind of short tonight. See you soon. Bye.